Namaskaram. Myself Dr. Ramya, HOD, Department of Panchakarma, Ashtamgam Vidyapeedham. Panchakarma, the most important weapon an Ayurveda physician has to combat various diseases. As a subject, Panchakarma comes under the final year for the BAMS students. So as a department, we have important two responsibilities over us. The first one, the clinical side. The second one, the academic side. In the clinical side, it is the Department of Panchakarma which is responsible for executing all treatment procedures in the patients who are admitted into our IP department. So all consultants, when they make the patient undergo any of the procedure, it happens under our monitoring.
Namaskaram. Myself Dr. Sri Parvati, Assistant Professor in the Department of Panchakarma, Ashtamgam Vidyapeedham. Panchakarma as a subject, the students study in their final year of the course and they are given both theoretical and practical trainings. The theory hours are dealt in the classroom and for their practical training they are given in the Panchakarma theatre complex. We have made the arrangement for a dummy on which they are made to practice the procedures initially before they practice it on a patient.
On the clinical side, we have a strong team of nearly 20 therapists, 10 female therapists, 10 male therapists, supported by 2 nursing staff, 1 exclusive Panchakarma medical officer, and who are totally guided by the faculty at Department of Panchakarma. When a patient gets admitted in the hospital IPD by a consultant, and when he decides a particular procedure for the patient, the information is immediately passed on from the medical officer at the IPD to the Panchakarma medical officer. The Panchakarma medical officer schedules each procedure for a stipulated time as intended by the consultant. And once the patient gets into the Panchakarma theatre for the procedure, initially the fitness of the patient is taken by monitoring his vitals etc. by the nursing staff and also by basically understanding the basic status of the patient by the Panchakarma medical officer. And once the treatment is executed, the patient is made to take rest in the theatre complex itself, and then he is usually given bath etc. as Panchakarma in the theatre complex itself, and then once again checked for vitals if needed and sent back to the theatre. Every procedure is monitored by the Panchakarma medical officer, and if at all there is any observation that need to be passed on to the consultant, it is immediately passed on to the consultant. So in this way, we take care of each and every aspect of executing any of the Panchakarma or any of the Kriya Krama so that we can give the best as far as possible for each patient.
Before performing any Panchakarma procedure like Vamana, Virejana, Vasti or Nasya to a patient, we assess the patient priorly to ensure that the patient is fit for the procedure. If we find any anal issues with the patient assigned for Vasti, we send them for a parectal examination to the Shalya department, and after their assessment only we perform the procedure. If we find any discrepancy with the heart rate or rhythm of the patient, we take an ECG of the patient and consult with the Nidana department, and with their opinion we reschedule or modify the procedure. Similarly, after every procedure, maybe it is Sinehana, Svedana or Shiro procedures, we make the assessment of the procedure for an academic purpose so that we can get a data of the procedure or what the procedure performs on the patient.